We talk some more on curbing the fourth wave. Joining us is Dr. Otefe Edebi. He's a consultant psychiatrist and psychologist, also a medical director, Grace Hill Place Hospital. He joins us on the program in Lagos. Thank you for joining us.
Thank you so much for having me on the program.
All right. Let's begin. Quite a lot has been happening since the pandemic, and we've entered yet another year and seemingly battling a new variant. Do you think that the constant changes and the narrative about efficacy of vaccines, from protection to reduction in fatality ratios, has perhaps in any way affected the psyche of Nigerians about the dangers that COVID-19 poses?
Oh, definitely it has. It has, and it's not a new phenomenon. You know, the fact that the conversation, the narrative about the fatality keeps changing. So, interestingly, in history, there was a similar situation in World War II in the UK. They had imagined that the bombing of the Germans was going to cause so much panic in the land, so much hysteria in the land, and they had prepared more psychiatric facilities.
Dr. Debbie.
For the assumed scare that and the psychic was going to have. They assumed that it was going to have an impact on them, but you know what they saw was that even after the bombings and all of that, the people did not react. So what's happening here is it's a case of what we call there are three impacts in terms of the psychic. There's something called the people who are directly affected, those who COVID directly affected. Then you have the near misses, those who were close to the people who were affected. And then you have the remote miss. And in Nigeria, we have more remote misses. And when you have more remote misses, what that simply means is that we only hear, most Nigerians, because of the fatality rates, it's when you talk about 3,000 in a population of almost 200 million, it's quite, and then when you talk about we have more remote misses, people who only hear from afar that COVID is present. So, and when you have remote misses, you often have people often thinking, their psychic usually is that of, we are not vulnerable to this challenge. So that's what we are having in Nigeria, because we have more remote misses than near misses. And that's because our fatality rate is quite low compared to other nations, developed nations, and all of that. So that has affected our psyche.
Does that also apply on the issue of hesitancy or the outright, unwillingness to take the vaccines? Is there a sort of mental willingness to take risks given the situation of relatively low death?
Yeah, like I said, relatively low death leads to us having this psychic that we are not necessarily vulnerable to the condition. I mean, I've heard people say, oh, it can be likened to malaria and all of that. I mean, these are facts in terms of, so you hear people say that. So the fact that we don't feel we are that vulnerable, it kind of affects our receptiveness towards taking the vaccine.
What can authorities do to change the psyche of citizens to enable a wider embrace of some of the protocols, the vaccines? I mean, given, the human being and social interaction.
I think it's already what we are doing, and I think we just need to keep working on what we are doing, which is our good community system. So we don't have, compared to developed nations, we don't have as strong hospital systems or hospital facilities like they do have, but we have a good community health system. So when we go to the grassroots, that's where, like our polio eradication, the vaccines is quite effective. And I think that that's one of the ways we can use to improve the uptake of the vaccine. So let's address it from a community-based method, which we've used in other vaccinations. I think that would be an effective way of increasing the uptake, which is what a lot of states are doing. So that's quite effective.
Do you think there are other examples, what we can learn from parts of the world, you know, to sort of adopt, to impact the psyche of Nigerians towards embracing better appreciation of health risks generally?
Now, psychic really has to do with information. You know, the thinking of someone is based on, or yeah, the perception is based on how he thinks, and the thinking is based on the information that the person has available. In one of the videos we watched earlier, we saw someone say we were initially afraid. So that's because of the kind of information they have received. So all we really need to keep doing is put out more information out there in strategic places like we're doing, and that will keep changing the mindset. So it's really about changing the mindset, and by changing the mindset, there will be better uptake and better receptibility to the vaccine.
We'd like to thank you for joining us on the program. Dr. Otefe Debe is a consultant, psychiatrist, psychologist, and medical director, Grace Hill Place Hospital in Lagos. Thanks again for joining us.
Thank you for having me.